We have qualified mentors in our team who are experienced regarding the UK exams. We will start with the presentation first, and then at the end, in the remaining time, we will take the question answers from you. We will present our presentation. Meanwhile, you can put all your doubts in the chat box, which can be taken after the presentation. We would try our best to take all the questions in our limit, but if some questions remain unanswered, or if you get the doubts even after the session, you can go back to our website. You can have all the information from there, and also you can connect to us on various platforms like Facebook, Instagram, LinkedIn, YouTube, etc., wherever you like. And all the information is available again on our website now from today. Now, without wasting much time, I'll start with the presentation. So, we will be covering our presentation under these headings. So, first of all, what is basically ORE or LDS? So, ORE is Overseas Registration Examination, which is required to pass for practicing as a dentist in UK, and it is conducted by General Dental Council, UK. LDS is License of Dental Surgery, which is awarded by Royal College of Surgeons, England. So ORE is an exam to pass. It is not a degree. Okay. Then what is the process of examination? So it's not like that the gates get open, you book the exams and you get to write the exam. No. You have to first register. You have to submit certain kind of documents as a package of application to the GDC, and then the GDC panel will verify it, will assess your application, will give you a new eGDC account so that you can book your slot for the examinations from that particular account. So those documents have to be submitted before booking the slot in the examination, and they have to be submitted in a certain way to the GDC. Otherwise, GDC tends to reject them. So we also provide you the guidance and support in that. Once you are registered, you will be informed with the help of your registration email ID about the upcoming exams. And we suggest that when you start the procedure of submitting the application, from there only you should start the preparation of examination also. These both the things should go hand in hand, because it takes, like nowadays it is taking 4 to 5 months for the GDC to take decision on each application. So you don't want to waste your time while they verify your application. So start preparing for your exam as soon as you have decided to appear for ORE or LDS. Then you have to, when the gates will be open, then you have to try to book the exam in that particular session. After passing part 1, you have to straight away start preparing the part 2. Again, it is same. You have to book the slot, appear for it. Booking the slot is completely based on first come, first serve basis. Okay. So here your luck also matters a lot. Even if you are prepared for the exam, everything is all right, but it might happen you don't get the slot and you have to wait for another ORE exam. So this is a bit tricky about this particular exam. After clearing part 1 and part 2, you need not to have any kind of training. You can directly practice as a dentist in UK. Okay. So this is all about the process for ORE exams. It's a brief. Then we move on to the details of examination. So ORE is conducted basically on computer. It is not a pen and paper based exam. It is held twice a year. It is conducted in 2 parts, part 1 and part 2. Part 1 is again consist of 2 papers, paper A and paper B. Each paper consists of 200 questions which are needed to be solved in 3 hours. That means it is like 200 questions in 180 minutes. Now, part 1 is conducted in a stretch of 2 days. Paper A would be conducted on first day and paper B will be conducted on second day. Paper A covers the basic subjects like anatomy, physiology, biochem, okay, etc., microbiology. like these subjects, and paper B basically covers the clinical subjects like periodontics, prosthodontics, endodontics, pedodontics, etc. So some subjects are a bit overlapping, but then grossly you can divide these two papers according to basic and clinical subjects. Part 2 is the practical based examination. It has 4 components which would be taken care by, which would be discussed in detail in the later part of this presentation by Dr. Jasmine, which is the mentor of our team. She teaches part 2 specifically. And GDC charges £800 for conducting part 1, and for part 2 they charge you to £2,800. Now this £800 will be taken once you have got the slot in the exam, not before that. Okay, and GDC don't charge anything for your assessment of application. Now the types of questions which are asked in ORE and LDS are MCQ types and EMCQ types. So MCQ basically you get the 4 options and you have to choose one single best answer. The 4 options, the questions are basically mostly asked on the image, or they could be fact based, or they could be numerical based, in which you have to use some formulas to calculate the answers. And fourth one, they could be statistic based. While EMCQs are generally in the form of match the column, where one column have the questions and the other column have the corresponding answers. Answers could be more than that of the questions, and you have to pick the answer from that particular list. And these are mostly fact based. I have given here one example of EMCQ. Like for this bottom, you can see a list of situation oral conditions, and these are on the top. There is a list of diseased condition. So you have to actually match the column of these oral conditions with these diseased conditions, the oral condition or the oral situation in which these disease can be associated. So that's how you have to match them. So for 5 conditions, you have 8 options, and from these options, you need to pick for each condition. So that's how it is, how the EMCQs are asked. So these 2 types are majorly asked in both ORE and LDS. Next, we move on to the scoring of exam. So overall, you need 50% to pass. Okay, so above 50%, it is a pass. Below 50%, it is a fail. There is no ranking system. There is no negative marking. So we recommend that you should actually answer every question. You should attempt every question, since there is no negative marking. No ranking, so there is no competition among yourself. The competition is with you only, that you have to score minimum 50%. Okay. Next, we move on to the LDS. So unlike ORE, which is conducted in 2 parts, LDS is conducted in 3 parts. So LDS 1 is basically theory based exam, and LDS part 2 and part 3 are practical based exams. LDS part 1 can be given from the comfort of your home. For this, you don't have to visit UK, whereas for ORE, for both the parts, you have to visit to UK. And for LDS part 2, part 3, you have to definitely, of course, visit to UK for appearing in the examinations, because these are practical based and are evaluated at their centers. Next, we move on to what is the difference between ORE and LDS. So ORE consists of 2 papers. LDS again, it is consist of LDS part 1 also consists of 2 papers. The only difference is LDS is ORE is conducted in 2 days. Paper A on the first day and paper B on the second day, whereas LDS has 2 papers on the same day itself. So you appear for the exam for 6 hours in one single day. ORE 1 held twice a year. This is held once a year, LDS. There are mixed papers of MCQ and EMCQ in both the exams. 200 slots are there per exam for ORE, which is held twice a year. Currently, this is only the system. And for LDS, there are 120 slots per exam. For ORE, up to 4 attempts are allowed. For LDS, also up to 4 attempts are allowed to pass part 1. Slots are provided in both the exams on first come, first serve basis. Okay. Next, we move on to the ORE part 2 and LDS part 2 and 3 details. I will ask Dr. Jasmine, could you please unmute yourself and carry on from here?
Yes, so thank you so much. Right, I'll just give you a brief intro about myself. I'm a practicing dentist here, and I have cleared both the exams. So we can essentially give you the direction, the first hand direction of how both the exams works. Now, Dr. Ankita really summarized it really well, that how part one of LDS and ORE happens. The only thing I can suggest you is the core preparation is the same, guys. So you would have to be really thorough for the part one. Once you have cleared part one, don't waste your time, because that same knowledge is carry forward for your part two exams. Now, as Dr. Ankita mentioned, ORE is done in two parts: part one theory, part two practical. LDS has three parts: part one theory, part two and three are practicals. So let's go forward and see how these parts differ from each other. Now, ORE in the part two exam will have four components. Okay. The same four components are there for LDS as well, but it is divided into two parts, part two and part three. So essentially, you are being judged on the same four components in both the exams. Now, ORE, you will have one component known as DTP, which is diagnosis and treatment planning, OSCE, which is a structured exam to see how you communicate with the patients, medical emergencies, and Manikin. Now, on day one, you will have your OSCE examination, which is like a 2 hours examination. You will be standing in a corridor full of rooms. Each room you will be going for 5 minutes, so essentially 17 to 20 stations, and each station will have 5 minutes. You will be judged on how you communicate with the actors. Are you thorough with your guidelines? How good are you in your skilled work? That means rubber dam, X-ray holders, all that in nutshell. And then from there, how good you are in your written aspect, like how quickly you write a prescription, how quickly you write a referral letter, and all these, just for the example. Third component is the medical emergency. So day one, guys, is your OSCE. Day two is your DTP combined with your medical emergency. So first 1 hour in the morning is your DTP, and the second 1 hour is your medical emergencies. Now in ORE, the medical emergency is more of viva. So the examiner and you will talk one to one. He will ask you questions, you will answer, he will give you scenarios, you will answer. So that's the medical emergency bit. Now, in ORE, if you fail medical emergencies and you pass rest of the exams, you don't have to repeat any of the exam again. You just have to do the medical emergency again. However, if you fail any other part, say OSCE, DTP, or Manikin, you fail the entire exam. So you repeat the whole part two again. It's only excuse in medical emergency that, say for example, you pass DTP, OSCE, Manikin, and just failed medical emergencies, you just have to repeat medical emergencies. However, if you fail in OSCE or DTP or Manikin, you have to repeat the whole exam again, which is expensive, but and exhausting both financially and physically. So yes, but we do try to help you out to clear everything in one go. Now for LDS, once you clear part one, Dr. Ankita, can we go to the previous slide, please?
Sure.
The slide after, sorry. Yes, thank you.
Oh, okay, this
For
one.
the LDS, the same exam. Sorry, the slide that was there before this one, please. Uh, yeah, this one. Please hold on to this one. Thank you. Now, for LDS, the same four components takes part in two parts. Okay, so part two is your verbal thing. That means you do unseen cases, which is a replica of DTP. It's just called unseen cases in LDS. Then you have OSCE, which is cut copy paste of OSCE in ORE. And then you have medical emergencies. Now, day one, guys, it's your OSCE and medical emergency day, in which your medical emergencies are essentially sprinkled in the OSCE station. So it is slight different. You don't have a viva here, but you have to enact how will you work if there is a medical emergency. So again, we will be training you for this component once that time comes, and if you decide to stay with us in part 2 as well. Unseen cases, the difference I will explain you later on, that how unseen cases and DTP differs from each other. Now, once you pass the part 2, you're done. Okay. So once you pass with part 2, you're done with part 2, and then you go ahead with the Manikin. So you essentially focus just on Manikin. Say, for example, if you fail in Manikin, you fail in just Manikin. You do not fail in the whole part 2, unlike ORE. So this is a good thing. Say you can divide your cost, which is rather than paying 3,000 or gambling 3,000 in one go, you gamble 1,500. Be sure that okay, I've cleared this. Then you put on 1,500 again and you clear the Manikin part. So that's a bit of a, I take it as an advantage, but some people may say, okay, it's a disadvantage. It is kind of a disadvantage because it takes longer for you to get registered as a dentist. Okay, so yes, it's up to you guys, whatever you like. So now can we go ahead how the OSCEs and DTP in ORE and unseen in LDS are different from each other. The slide with the chart. Yes, thank you. Now, this is the DTP component, day 3 of your ORE Part 2 exam, the first half. You will be given just one case. Now, in that one case, you will have 10 minutes of taking a history from a patient. It has a structured approach, which will be again taught to you in detail in the course. Then you have some time for your investigations. So essentially, you write your investigation for 11 minutes. You write what investigations are you going to carry forward, what is your diagnosis, and how and what else you can do in this patient. So all these things, so your differentials, your investigation, your X-ray reporting, all comes in this 11 minutes. And the same after this, you will be given a green sheet in which you will write the whole detailed treatment plan for the patient. So 10 minutes for history, 11 minutes for your uh, investigations, and then another 15 minutes for your, sorry, another 20 minutes for your uh, management, which is like what are you going to do with this patient. And the next 10 minutes you will talk to the patient, explain your diagnosis, and explain how are you going to help him out today. So that's the end of the 1 hour of your DTP. Now let's go how the unseen cases are organized in the LDS exam. Can we go to the next slide, please? Yes. Now, in LDS exam, in the unseen case, rather than having just one case, like in ORE, you have 4 cases. So you have, I take it in a way that I have some opportunity to make mistake because I have 4 cases. So I can be, okay, I can make some mistakes. In ORE, you have to be to the point. Now, you will have 4 cases of half an hour each. So first 10 minutes you will take history, which is same as ORE. Then for next 10 minutes, you will be writing the investigation, doing some task, whatever they give you, like prescription or referral. And the 10 minutes after, you will be giving the patient the treatment plan, and you will be explaining how you're going to manage the treatment. So that's case one. And similarly, you will have three other cases. So in total, you will have four unseen cases. So rather than a 1 hour exam, it would be around 2 hours. Okay, so that's a brief difference between how unseen and DTP cases are different from each other. Can we go ahead, please? Dr. Ankita, yeah, thank you. Now, in OSCEs, the in ORE OSCE, you have 5 minutes to perform a particular task. You get 1 minute to read a question, and then 5 minutes to do the task. Task can be talking to the actor, giving post-operative instructions, writing a prescription, anything. So it varies. It has so there are few questions that are repeated in the OSCEs every time. So again, in part two, we go through extensively on what has come, what can be pilot, or what else is getting updated every year. So we give you an extensive list of stations that have come, and we make you practice everything in the course. So that's OSCE in ORE. Now in LDS, the benefit is you get for the same amount of work, you get 7 minutes rather than five. So time is in your court. So you get more time to perform the same station in LDS as compared to ORE. But other than that, it's all the same. So can we go ahead, please? So just the Manikin now. Now Manikin is a part of part two exam in ORE. So you have to pass that Manikin component as well in line with everything else. So you don't get the chance to fail Manikin, just Manikin, and not repeat every other thing. So there are most of the candidates, they just fail Manikin and they have to redo everything again. So it's exhausting, but yes, if you pass the whole exam, you're done for life, so you don't have to give any other exams. So it's a 3 hours exam. You get at the start of the exam, you get 20 to 30 minutes just to get well versed on with how the equipment works, how the chair is, if you're happy with everything, your set of equipments, your mannequin head, everything. You check the water pressure, air pressure, burrs, instruments, you check everything. And in that 30 minutes, if you have any troubles, you let the nurse know and they sort the trouble out. And after that, they will give you the task which are to be done in the 3 hours. Now, the difference between the mannequin of ORE and the mannequin of LDS is that in mannequin of ORE, the examiner is on your head. So for each row, there are two examiners, and they keep moving from the start to end. So you will be constantly assessed on how you are sitting, is your posture right, if your chair position is right, if you're not bending too much, health and safety. So you're constantly being examined and monitored by the examiner. After every exercise, you have to call the examiner. They will mark you on that exercise, and then you go ahead with the second one. So you can't say, okay, I'm going to crown cut this, make a cavity in this, and then restore it. Or make a cavity in this, crown cut, and then restore at the end. You don't get to decide. The examiner will tell you, okay, fine, go ahead with crown cutting now, or go ahead with restoration now. But you have to show your work before you switch on to another exercise. So you have to have that in that 3 hour time, you have to manage the examiner coming and marking you as well. So essentially the whole 3 hours are not yours, that is collaborated or combined with the examiner coming to your chair, seeing it, marking it, and leaving your chair. And this can be possible that he is marking someone else and you have to wait for him to come, and then he assess your work, and then you go ahead with the second one, and you're not given any extra time for that. So that's race against time in ORE. In LDS, you're not monitored or you're not assessed in those 3 hours. So the examiners are there, but they are sitting at one desk and they're just seeing that no one is cheating and everything. But other than that, they don't disturb you. So you decide how you want to work. If you want to switch between exercises, it's up to you. After 3 hours, they will take your jaws and then they assess it under a high defined microscope. So in ORE, they just look it through via loops. In LDS, they look it via microscope. So that's another difference between ORE and LDS. Okay, can we go ahead, please? So this is just to show you how the exam center looks like. That's how the Queen Mary Manikin lab is. You will be essentially doing your exam in the exact same setup. Can we see another picture, please? So that's the mannequin head, set of equipments. So essentially, you'll be working on a setup exactly like this. Yeah, can we go ahead, please? So burrs and equipments are standard. You can't choose your burrs. Once we start with the our mannequin courses, we will be giving you the idea or giving you a detailed list of what burrs are included in the exams and what instruments are given to you in the exams. Can we go ahead, please? This is just for your reference on how the equipment looks like. Yeah, forward, please. Yeah, I think just for your reference. Okay, you can go ahead.
Okay, thank you, Dr. Jasmine, for wonderful description about part two of ORE and part 2 and part 3 of LDS. Now we will move on to one of the major components, that how to prepare for ORE or LDS examination, especially for part 1 we are talking about here. So these are the list of books which are usually used by the ORE aspirants. That is Oxford Handbook of Clinical Dentistry, Pink Book, and Oxford Handbook of Applied Sciences, famously called Blue Book. These two are considered to be the Bibles of ORE examinations. Apart from that, you need other textbooks like Churchill's Pocketbook Dentistry, Vendors for Physiology, Carson for Oral Medicine, B.D. Charasia for Anatomy, Eric and Waits for Radiology, and there are certain BDA sheets which are issued in time to time by British Dental Association, and there are certain kind of feedbacks which are given by the students who appear for the examinations. So these all are required and are sufficient to prepare for part 1 of both the examinations. Key points which we actually recommend for our students, that the study or the preparation should be conceptual based, because there are certain clinical scenarios which are asked in the questions, and based on that you have to answer the question. So there are various twists where are concept based question, clinical based questions, in which you will be not trapped only if you will have the crystal clear concepts and based study. There should be no mugging up, because it at the end it is of no use. Just the facts can be mugged up, but the concepts cannot. So just concentrate on the concepts, because most of the questions are clinical based, and sometimes there are direct questions also. But in order to fetch the required percentage of marks, the preparation should be totally on the basis of concepts. Again, I would insist on speed, because 200 questions have to be solved in the stretch of 180 minutes. So you yourself can calculate that you don't even get a 1 full minute for each question. It is less than that. So the more you practice the questions, the various patterns of questions on various topics, the more thorough you are with the exam. Okay. So this all requires a smartest study. So answer to this is basically, I will ask you question, do we have full time to prepare for ORE or LDS? No, we don't have, because either we are engaged in our masters or we all are doing jobs. So we are not completely vacant for our ORE and LDS preparations. Is it required to read and learn everything? So there were like more than 20 subjects in our BDS. In the stretch of like 5 years, we have completed those subjects. But we have to here complete all those subjects within 4 months. So we cannot learn and read everything, and it is not required also from the examination point of view. Everything is not asked and everything is not important. Can we retain the whole syllabus? Of course not, because we have a capacity, so we can't retain everything. So here comes the concept of smart study, that you just need to read what is required to be read. Okay. How can we help you? First of all, we all are BDS graduates. We are familiar with all kind of subjects, right? We can study ourselves very well because we have passed the graduation. So we know what are the subjects, what are the content of subjects. It's just we need to know basically what to study. So here our role comes into play, that ORE material, we provide you the updated ORE material with important markings of all the books like pink book, blue book, as well as the textbooks which are required in addition to pink book, blue book, and the updated BDA sheets, latest one. We provide you question bank to practice and understand the different patterns of question asked. So here the question bank solves the two purpose. First, you get to know the pattern of examination, and second, you also know the level of your preparation, how prepared you are. Okay, and which subjects are your weakness, where is your preparation standing. So by solving the question bank, you can easily self-evaluate yourself. Then we provide you subject-wise questions and feedbacks from previous years. And we also conduct the doubt solving classes. So sometimes you get stuck, or sometimes get confused between the options, and you don't know which one is correct and why this is correct and why this is not. So for all those questions, we conduct the doubt solving sessions, so that you don't stuck to a particular topic and your concepts get clear in relation to that particular topic. Last, we also conduct the mock exams which simulate the ORE and LDS pattern, so that you don't find something new in the exam and you are already in practice with those patterns. Now, I would just brief you how we go about in our courses. Basically, if we take the subject, for example, we are taking anatomy. So we will conduct the live session where we will give you the markings, tips and tricks about that particular subject, how to learn, how to retain some mnemonics, flashcards related to subject. These will be provided to you. Then the question bank related to that particular subject will be given. And at the end of a week, or the time which has been allotted to that subject, at the end of that subject, we will take a unit test based on that particular topic. Like it would be consist of 30 to 35 questions which need to be solved in particular time frame. After that, we conduct the doubt session on the same subject. So that this goes on with every subject for till we complete our course. And at the end of course, we conduct the mock sessions where 200 questions need to be solved in 3 hours, similar to that of ORE and LDS. Now, if we talk about the packages for part one, we don't offer and we don't think that it is required. Like we don't give any kind of fancy packages. We have just one package which is required as per our experience. That is whole updated ORE material, which includes textbook, BDA sheets and feedbacks, live sessions of marking page-wise for each subject and textbook with great tips and tricks, of course, subject-wise question bank after completion of every subject, regular unit test at the end of each subject, and doubt sessions after the subject completion. At the end, mock exams. 3 to 4 mock exams will be conducted at the end. Duration of this course is around 4 months. After the course also, we are not leaving you. We will be there for you till your exams or till 18 months. And this course is for just £450. Now, I don't think so. After all these things, you will require anything in extra. But if some people prefer to read from the notes, then we have also notes with us. We can give you, we can provide them to you subject wise on some additional cost. Various flashcard, MCQ, mnemonics, we keep on updating on our Insta page, FB page, and website. Dr. Jasmine, would you like to talk about LDS Part 2 packages?
Yes, so we do take both ORE and LDS Part 2 packages. We talk about LDS Part 2, but not Part 3 because we do not cover Manikin just yet. But it's on our talks to have a Manikin setup soon, so we'll be updating in case we have that news soon. Now, for ORE and LDS Part 2, it's not as extensive as Part 1, right? We will have a 7 days continuous course for each of the component, which is OSCE 7 days, DTP 7 days, and Unseen if you're giving LDS 7 days additional. You will be told about the approach, the scenarios that have come, and also you will be assessed one on one on how you are performed and if you're ready for the next upcoming exam. It would be 2 hours of teaching every day for 7 days. We will be updating you the dates as they get released. And medical emergencies is a separate component for both ORE and LDS. So LDS people will have a separate 3 day course, and ORE people will have a separate medical emergency 3 day course. Same goes for DTP. LDS people will have a different unseen course, and the ORE people will have a 7 days different DTP course. So we do not mix up both the exam because the approach is different, so the teaching is different. So you will have the dates are constantly are released and it will be updated, but it's one step at a time. Once we clear part 1, then we are always there for part 2 for you guys. Okay, and the cost of it, Dr. Ankita would be telling you.
Yeah, we have the brochure available with us because different components have different costs. So I have not indicated here right now. If anybody likes to know about them, please contact us and our team. We will provide you the brochure with all the details. Apart from that, we also provide the guidance and support with the application procedure. I would just brief the services we have. And also you can visit our website www.yourdentaltutor.co.uk, where you will find all the services listed there, and courses for ORE exams and LDS exams as we have discussed just now. We have also arranged the IELTS mentor who are certified, and we have asked them to specifically, coach you for clearing the band of 7 with 6.5 in each section, because many of the students approach us for this IELTS also. So we have added this service in on our website. You can get all the details there. Um, we have oral therapist and hygienist back to practice courses. So the people who have actually applied for oral therapist and hygienist and don't have any kind of exposure to UK guidelines, where how the clinic works there, how we have to practice there as a therapist or hygienist. So we do conduct the courses for them also, so that they can start the practice quite confidently in UK. And
But I
if
just
you are,
want to add, sorry, Dr. Ankita. Yeah, I just want to add, this is not the back to practice course you will be either if you are getting an objection, because
yeah,
that back to practice course is hands on. Ours is an online one, if I'm right, Dr. Ankita.
yeah,
So,
I was
yeah.
about to tell, but yes,
Oh,
okay,
sorry. Okay. So,
no
yeah. So
problem.
it is an online course, but we will make you so confident on how to go ahead and deal with the patient, because you guys are dentists. You know how the air rotor works, how the scaler works. All you need to know how your mouth should work and how should your typing work. These are the two things, and we will train you so good that you will not feel even a slight bit of scared of fear of unknown, that okay, what am I going to do once I enter the clinic. You will be very, very prepared with this one.
Yeah, thank you so much, Dr. Jasmine. And we also are giving our services to the hygienist and therapist which are overseas qualified, because the pathways is still open for them. Unfortunately, it is closed for the overseas dentist, but for overseas hygienist and therapist, it is open and they can apply. So if you come in contact with any of them and they are looking for any kind of such services, you can connect them to us. Apart from that, we also address the objections and rejections taken on the DCP application. All the details are there on the website. Please, if you want any of these services, just refer the website and you can contact us on any of the platforms too. These are our contact platforms and contact details. Best way is to visit the website and have the direct contacts.